Hello and welcome to Telegraph Studios. I'm Alistair Greener and today we're discussing the very important issue of food security. And joining me is Dr. Brian Evans, who's the Deputy Director General at the OIE. Where's it all going wrong?
Well, primarily right now, it's because we haven't made the investments in infrastructure for early detection of disease and early reporting of disease. As a consequence, we are losing animals, significant numbers of animals, probably 30% of all animals born whose intended purpose is for food never make it into the food supply. They're lost due to disease situations or in the event of a disease that has spread so far, then there are extraordinary measures that have to be taken, often leading to massive animal depopulations. So we lose animal protein both by the death of animals and as a consequence of some of the disease control activities.
You mentioned consequences. What exactly do you mean by consequences? Can you be specific?
Absolutely, yes. There are a number of very important consequences that derive from food insecurity. First and foremost is political instability. We've seen history written, we've seen significant political unrest at the global level with huge social consequences as a result of food insecurity. We have significant issues as well around health and health well-being of populations. Food security, in terms of nutritional security, is very essential for physical health, physical development, mental health, mental development, productivity. So it has a huge impact on the productivity and economies of many countries as well.
You mentioned 30% there. What does that actually represent in real terms?
Well, it represents a significant portion of what could be viable animal protein for nutritional purposes. As I've alluded to, we currently lose on an annual basis more people through malnutrition than we do actually through a number of major disease situations. And keeping that protein is very important in the food supply. It's important for physical development, it's important for mental development, it's important for productivity, it's important to the economies of these countries that are largely affected. So it's not just about the food loss. There are a number of other tangential issues associated with that.
You've been really articulate about what the problems are. We also now know what we need to do about it. What's stopping us? What's actually intervening to prevent us from solving this?
Well, primarily three things, I think, are the main obstacles that we're trying to overcome. One is the fact that, as I say, we're dealing in a world of significant diversity, cultural, social values, religious diversity. So it takes time to build the consensus between a science approach and the socially accepted norms that will encompass a broad swath of populations and interests in that regard. Secondarily, we're also dealing with the reality currently that in many countries, they just do not have the basic legislation, they don't have the basic capacity, they don't have the education standards that would allow for a competent veterinary service or animal health community service to be present in that country to prevent diseases from breaking out and responding to them quickly when they do. And then finally, the other issue I think that that is impeding us at this point in time, again, is the fact that we are too much responding, as I said earlier, to one-off events. We're trying to be, our efforts are largely directed at this point in time to try and eliminate an event, a biological event, but without really making the investments necessary to deal with a horizontal issue.
You say horizontal issue. What do you mean by that?
Well,
how does that manifest itself?
Sure. Horizontal issue in the context that, as I said, animal disease emerges for a number of reasons. It can emerge from the fact that we are, through deforestation, we're displacing wildlife species. These wildlife species come now in greater contact, both with humans, but also with domestic animals. So we're now seeing transfer of those diseases from wildlife to domestic animals, and invariably either through the food supply or more directly, infectious diseases, directly to humans. So we need to think very carefully about our land use. We need to think very carefully about those impacts. And the other area we need to be very conscious, of course, is around climate change. The reality of climate change changes the disease patterns. Biting insects that can transmit disease. They cover a wider geographic area. They live longer. They're not killed off by the winter frost in the way that would have been before. So these are all changing biological dynamics that have to be taken into account so that when we are addressing these problems, we are addressing them in an integrated, synergistic way.
Are there any parts of the world where this is even more critical than others?
Absolutely. The very unfortunate part of all of this is that those countries which are already suffering from significant poverty are the most impacted. They don't have the infrastructure. They don't have the basic animal production systems necessary to have food security.
So which ones are those?
Certain countries in Africa, Western Africa, Southeast Asia, these are countries which are already struggling, that don't have the infrastructure in place, that don't have the capacity to be self-sufficient in food, and therefore have to find alternatives to their food supply, some of them not very healthy.